If you look at all these sleep apnea devices, what do they function to do? Bring the lower jaw forward. So you have
Yeah.
all this muscle spasm, you're not able to breathe. All these muscles are impinging upon the artery, the vein, the nerve, the lymphatic movement. You have more hormonal receptors in your TMJ joint than any other part of the body.
You're listening to the What the Gut podcast, where busy moms can come for a holistic approach to health and vitality. I'm Allison, your host, a holistic health and wellness coach. In this space, we'll dive into the intricacies of achieving holistic wellness while balancing the demands of daily life as a busy mom. What the Gut is your haven for navigating the challenges that come with juggling numerous tasks while aiming for a healthier, more balanced life. Join me as we uncover practical solutions to common health hurdles, from managing fatigue to understanding all things gut health. Through insightful discussions, actionable insights, and tailored lifestyle strategies, my goal here is to empower you to embrace a vibrant, nourishing life while saying goodbye to being overwhelmed and exhausted. So if you're ready to embark on this transformative journey towards holistic well-being, hit that subscribe button. Get ready to discover the secrets to thriving in motherhood while nurturing your overall wellness. A quick reminder, everything discussed here is for educational and empowering purposes only and is not intended for personalized medical advice. Consult your personal healthcare provider for personalized medical advice. Welcome to What the Gut, where we create our own path to holistic health, one episode at a time. I'm your host, Allison, and we have the pleasure of speaking with Dr. Alireza Panahpour, a pioneer in holistic and biological dentistry. Dr. Panahpour, coming from a long line of dentists, was captivated by dental care from a young age. Now, as a biological dentist, he uses holistic, natural materials and state-of-the-art technology to address both local and systemic health effects of dental treatment. His approach integrates diet, immune health, structural integrity, and energetic alignment with traditional dental care. Specializing in safe mercury filling removal, proper tooth extraction, and preventative dentistry, Dr. Panahpour has over 25 years of experience. He is a sought after speaker at holistic dental conferences and naturopathic schools, and his book, The Good Dentist, documents his extensive research and patient success stories. He collaborates globally with medical professionals to treat chronically ill patients who have found no other solutions. His commitment to holistic dental health has transformed countless lives and advanced public awareness about the crucial link between dental and overall health. So, join me in welcoming Dr. Panahpour as we hear more about his groundbreaking practices. Whether you're into holistic health or curious about the future of dentistry, this episode is for you. It's awesome to have you here today on the podcast. Dr. Panahpour, how are you?
I'm doing very well, Allison. Thank you so much for having me.
I know that you do come from a long line of dentistry in your family. As far as being into the holistic space, I know that there's a million things I could ask. I would love for you to just explain kind of what that is for my listeners who maybe have never even heard that term before.
Correct. Well, the terms holistic dentistry, biological dentistry, natural dentistry, green dentistry, they're not specialized basically as far as, let's say, a general dentist compared to an endodontist or a periodontist. So there's no specialty per se. It's really up to the dentist and their lifestyle and the way they want to basically overlook and run their practices. So it really goes to the dentist choice and the continuing education courses that that patient takes upon himself, you know, to continue education. For me, I realized really early, and I was really disappointed by what my life will be as a drill it, fill it, bill it, just a type of dentist. I knew dentistry has so much more to offer me. And I was truly lucky enough to come on upon a book really early during my dental training that was written by Dr. Weston Price. And that book really, really sort of opened my heart And I knew that's going to be my path in dentistry. So I took it upon myself to take as many continuation courses, residencies, master programs to just get more input, just understand better of the relationship of your teeth, your jaw, your cranium to the rest of the body. So, of course, you can Google holistic biological dentist and you're going to get these wonderful websites, but at the end of the day, it doesn't mean anything. It's really dependent upon what that doctor does in their career. I know that there's a lot of dentists, I call them weekend warriors, they have a normal dental practice, they take a weekend course, and on Monday, they're a biological or holistic dentist. So, just to all your audience out there, they really got to do their research. And let's say, for example, you need to go get a surgery done. Best to ask that dentist for their CV, curriculum vitae, and find that when was the last time this dentist took a course on surgical aspects of dentistry. Let's say you want to get a filling done. When was the last time this dentist took courses on reconstructive dentistry, adhesive dentistry, et cetera, et cetera? So you really, as a consumer, we have to do our research. I mean, I do my research, when it comes to my family. So that's what I recommend to all your listeners. Really do your dentist. Just because someone says they're biological or this or that, that doesn't mean anything. Specifically, if they say they do root canals. Root canals and a biological dentistry, it's a no, no. So that's a little introduction right there.
Yes, I love all of that. So, I am in Mississippi, and I guarantee you, most of my listeners have probably never heard of biological dentistry. I know until I really got into the functional medicine space myself, I never had heard of that. And so, I think this is something that a lot of people are probably hearing about for the very first time. I would love to ask you, thinking about dentistry and the connection that it has with the rest of our body, how is oral health connected to systemic conditions like diabetes, autoimmune issues, or cardiovascular disease?
I'll give you the perfect example. Between 1992 93, while I was going through my dental training, we were taught that if you have a patient who is diabetic, make sure you take extra care of their gums and their teeth, because diabetes and gum disease go hand in hand together. So instead of having the patients come in every, let's say, 6 months for a cleaning, have them come in every 3 months for a cleaning. Make sure they're on the right brushing, flossing, etc., etc. Fast forward 20 years later, well, we're not sure if diabetes causes gum disease or gum disease causes diabetes. This is what we refer to as oral systemic health. Now, we know that as we're sitting here and talking right now, Allison, and this is science, our immune system is dealing with over 2,000 or more different types of cancer cells. So really all we have on our side is our immune system. Okay. Now, any kind of a chronic issue, if it's your clenching and grinding, if it's your active gum disease, if it's a infected root canal, they're all tooth decay. They all have one thing in common. They're all chronic issues on your immune system. So let's say, as a physician, MD, functional medical doctor, osteopath, cardiologist, gynecologist, what have you, how can you get your patient well where they're dealing with other dental chronic issues? Of course, in their medical school training, they don't teach them anything about dental health. Well, they don't teach them anything about nutrition either, you know? So it's really up to that doctor to go above and beyond. So I do a lot of lectures to a lot of anywhere from different symposiums to private gatherings where I sit there and spend a whole weekend lecturing medical doctors, chiropractors, naturopaths, functional medical doctors of the importance of dental health as it relates to the rest of the body.
Yeah.
Oh, and of course, thank God for all the latest technology, for example, tomography. This is where they take these non invasive images of hot and cold areas of the body. And we've seen through these images how these dental infections directly through the facial artery and lymphatic system drain into the rest of the body, especially for female and the breast tissue, because there's so much lymphatic tissue in the breast. So we were able to, and through 3D imaging and all these other tests, we've seen that relation. So a lot of the medical doctors that I lecture to on Monday, Tuesday, when they go back to the office, they change their paperwork. They want to know, how often do you get your cleaning? Have you ever had gum disease? Do you have any root canals? Have you had old extraction sites, wisdom teeth extracted? Do you clench and grind your teeth? And if you're yes, 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 well, who's your dentist? How active is your dentist? Well, we know this person that lectured to us this last weekend, Dr. Panahpour. Go and get a consultation. For example, my office in Mexico, I am the first line of defense. We have a dental division, medical division. So the medical division will not take you in unless I give you a pass, because they are basically 100% sure that there's no way I can get you healthy. I can get you detox, chelated, fix your hormones, adrenals, thyroids, all of that if you're dealing with active dental issues.
Yeah. I love the connection to all of it, and I couldn't agree more. I think that's something that's such an issue in today's medical society, that it was just that everything is separate. There's a separate specialist for everything, and dental is completely separate, and it
And no one
just
has the idea what the other person is doing.
exactly.
The medicine in the 40s was completely different.
Yeah.
You know, a medical doctor that lived in a little town outside of, let's say Louisville, Kentucky, whatever, took care of the whole body, had knowledge of the whole body. But again, I don't want to get political, but insurance companies, pharmaceutical companies, they've taken our medicine and created this kind of like a fast food chain,
Exactly.
you know. And now when you hear that these pharmaceutical companies are putting these DNA in our food, that scares me.
Mhm.
That scares me a lot. For the first time in my life since COVID, I'm just not looking at a label that says organic. I will read every word on that package, Google it and research it.
Yeah.
I'm sure you heard of Whole Foods, organic California vegetables. You turn it around. There's a website that I looked on. It's not even an active website that says, it says from Thailand or China. What mean Thailand or China? So very disappointing, very disappointing. So as consumers, we definitely have to do our research.
Yeah, for sure. As far as hormonal health goes and oral health, how does a woman's menstrual cycle affect oral health?
Any kind of a chronic issue will first impact your body on adrenal level, thyroid, followed by hormones. Okay. Believe it or not, this research was done at University of Southern California Medical and Dental School. You have, as female, you have more hormonal receptors in your TMJ joint than any other part of the body. And I'll be able to correlate that with patients, young ladies, very early in stage of their life, getting their teeth extracted, getting braces which constricts everything. We have related that to hormonal issues, terrible patterns of cycles. So what they do, they put them on birth control pills to control that. They stay on birth control pills through high school, college, and now they're, let's say, in their late 20s, early 30s, they want to get their mercury fillings out, they want to get their root canals out, and they want to be pregnant in a few months. No, that's not going to happen. So
Yeah.
I can tell you. So, and right now, if you look at my website in the research section, I have research from, Pronounce University that says, especially women during their menopause and after their menopause, they are prone to cancer if they're dealing with dental issues, gum disease, infected root canals, etc., etc.
Yeah.
That's research. That's not me. you know. So again, any kind of a chronic issue will affect your hormonal levels. So some of the questions I ask from all my patients when they come in, of course, what's your blood type? I want to make sure that they're eating the right food for their blood type. Now, some people don't believe in it, but I do. Okay.
Yeah.
Do you poop every day?
A question I ask every day to
Yep.
anybody, my
So
children, my patients.
absolutely. So if you're not pooping every day, that means there's some sort of a liver gallbladder issue. And for me to go in there and give you injections that has to run through your liver, well, that's a no-no. We got to get that liver kind of going first. What's your cycles like? Is it on time? What do you crave during your cycles? I mean, a little bit chocolate, it's okay, you know, but when patients tell me I crave salt, well, I know there's a lack of minerals and electrolytes. I crave carbohydrates. I know there's a parasite issue. These were all that I learned in my Chinese medicine training. Were you in the military? Why do I ask that? Because we know military, they vaccinate them above and beyond. Do you have any scars on your body? Because we know that scars are interferences within the vitality of health. In Chinese medicine, health is when energy flows come impedantly through one system. How many children have you had? So these are some of the questions that I ask. But of course, the dental boards are kind of mad at me. What do you care? Of course I care. I mean, this is above and beyond your brushing and flossing,
Yeah.
especially with my female patients,
Yeah.
because I mean, I've said this in previous podcasts before. We're at our fourth generation of the American public slash world public that have been introduced to foods with pesticides, hormones, and antibiotics in our meat, the air, we can go on and on. And these issues has affected these individuals on a genetic level. And we know that through epigenetics, that damage in your genetics has been passed down from one generation to another generation. I think about 85% of the patients that I see are female patients, anywhere from the ages of 17, 18 to, 65, 70, 80. And these dental infections, these dental challenges affect these patients much more than my male patients. And
Yeah.
really, what I have understood is those hormones level. If that fire is not burning properly, nothing's going to be working properly. And
Right.
that over and over again. I'll give you a quick little example. And I actually did this lecture for a bunch of gynecologists, three specific patients, different states. When I asked them about their cycle, and they were in their like mid 30s, they said, "Yeah, we went through menopause like late 20s." I'm like, how is that possible? When we went through menopause, yeah, our doctor said it was okay.
Mm.
All three patients were clenching, grinding, structural issues. As soon as I placed them on my protocol with bite appliance to get the oxygenation movement going, to get the lymphatic movement, they all got their period.
Isn't that crazy?
I basically did a whole lecture. I got their consent and I did a whole lecture that all I did was basically because of the damage, the collapse of the cranium as it related to the rest of the body. And as I started working with them, I got the oxygenation, lymphatic, blood flow, draining going. They all got their cycles. It-
Yeah. So let me ask you, as far as like younger women, maybe even teenagers that struggle with teeth grinding or TMJ issues, do you think that is all hormonal related or what's your opinion on that?
Before braces, well, this could be some sort of a nutritional or skeletal issue.
Yeah.
Okay. And of course, toxins.
Yeah.
You
Okay.
know that right now there's been a research on how parasites cause you clenching and grinding.
Mhm.
How these parasites basically there's certain ones that are live in your brain and allow their host to feel anger and fear. And of course, toxins, if you're dealing with all these toxins that is affecting your development, I have a lot of patients that their moms bring these young ladies, 16, 17, to me. They said that our dentist says that we got to get the wisdom teeth extracted because there's not enough room in the jaw. And we know that through evolution, our craniums are getting bigger and our jaws are getting smaller. This is just epigenetics that's happening. But I look at this patient, I say, well, there is another choice. Instead of removing these wisdom teeth, let's go ahead and expand the jaw. They are 16, 17, they're still growing until the age of 22, 23. So instead of confining, let's expand. Let's make room for the wisdom teeth to come out. There's a reason why they call them wisdom teeth.
Yeah.
So that is my approach. So, of course, that patients, can go and pay, a couple of $100, $1,000 to get those wisdom teeth extracted, or $3,000, $4,000, either with me or an orthodontist, depends on how difficult the case is, to get things expanded, get things opened up. And our jaw is really our cranium. Upper teeth, upper jaw supports your orbits. So your upper teeth is really responsible for the front of your skull. Lower teeth, lower jaw, TMJ, back of the skull. So your bite really sets the tone for your cranium health. And
Yeah.
this is the engine.
Yeah.
Can you imagine the arteries, the veins, the lymphatic? This is the command center. So the last thing you want to do is restrict it.
Yeah.
Okay. Now,
That's
after races, well, that's very common. I would say about 90% of the patients, as soon as I got the braces, I started clenching and grinding. If you're going to go to an orthodontist, you want to make sure they have extensive training in cranial harmony, in cranial growth. Unfortunately, a lot of orthodontists just move the teeth around and they put a retainer. Why? Why do they put a retainer? Because the teeth are not happy where they're at, so they want to move. So they put the retainer to keep them there.
Mm.
My brother is a very active, famous orthodontist in Aliso Viejo. And when he decided to go to ortho school, and let me tell you, he dropped out of medical school to go to ortho school because he had such passion for it. I begged him, please make sure you get your master's in cranial harmony, in cranial growth. And he did. And that has set him aside completely above and beyond other orthodontists.
yeah. I just love the connection thinking about braces or retainer and TMJ and how that restricts everything. That's just not something I've ever you just don't think about. Like, it's not common to think about in today's society. And I know I've got 3 young kids and I'm like, well, they might need braces someday. But now I'm like, okay, but I mean, I know that there's pros and cons and every case is totally different, but a million years ago, people didn't have braces and they weren't removing all their wisdom teeth. And I mean, they
Correct.
weren't leaving Earth with less organs than what they came here with,
Correct.
right? And so I'm just curious what your view is on younger children and adults getting braces.
So there's a lot that goes into it. And as you said, every case is different, but I rather expand to make room than tighten things up.
Yeah.
We have a lot of patients that are brought to me that said, our orthodontist says, in order to fix her headaches and basically get her stop clenching and grinding, my daughter's going to need braces for the second time. No, absolutely not. First, we have to bring your daughter in harmony, which means the bite, the cranium has to be in harmony with shoulders and hip. Hence the word craniosacral. To make sure all the muscles of the head and neck, all the muscles of the mastication are happy, are in harmony. Only after when we achieve this, then we'll know where teeth are supposed to go.
Yeah.
And only after I work with very specific orthodontists to make sure the teeth are brought into position in that cranial harmony. Okay. So you asked me clenching and grinding. Why? Well, it's basically at the beginning, the body's losing faster than it's able to repair itself. That's number one.
Yeah.
Okay. Now, as for what different reasons, when this clenching and grinding happens, all the muscles of the mastication get tight. It's like, when you go to the gym, you have a good workout, you can't even turn out your arm because the muscle's so tense. But when these muscles get tense, the lower jaw gets retreated backwards. When the lower jaw goes back, it takes the tongue and the epiglottis back with it, cuts your airway. If you look at all these sleep apnea devices, what do they function to do? Bring the lower jaw forward. So you have
Yeah.
all this muscle spasm, you're not able to breathe. All these muscles are impinging upon the artery, the vein, the nerve, the lymphatic movement. And of course, when you're 12, 13, 14, 16, your immune system's strong. God, when I was that age, you cut my arm off, I grew another one the next day. Now,
Yeah.
the itty bitty cut, I have to light a candle with some oil, little prayer, another candle, because I don't heal as fast as I used to anymore. So with kids, their body compensates, 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 compensates. What is that compensation? Fight and flight.
Mhm. And then you become an adult years later and have this chronic disease processes
That
and
is embedded in your muscle memory. You know
yeah.
what I mean by muscle memory?
Yeah.
So that muscle, so these patients that young adults, and I see more and more of them, they have migraine headaches. The
Mhm.
light bothers them, high blood pressure, adrenal issues. It all started from their clenching and grinding due to whatever reason.
Yeah.
You come to me, you clenching and grinding. Yeah, most dentists give you a night guard, pop it in, and they always give you an upper night guard, if you've noticed. Well, that alone itself, okay. So the upper jaw is basically two bones that are come together, right? Every time you breathe in and out, there's a movement that's supposed to occur. That upper night guard stops that from happening.
Yeah. That's
So,
crazy.
yeah, and this is just anatomy, it's just science. Now, some of my
Yeah.
dentists that could be listening to this probably email me, call me, cuss at me, whatever, whatever. But if you come to me and just want a night guard, no, thank you. Have a nice day. I even don't want that responsibility. But if you truly want to get back on track, my protocol takes about almost a year. This is where I work with different appliances and specific chiropractors. Bring your body in harmony without paying attention to shoulders, hip, neck, what have you.
Yeah.
Structural harmony is very, very important.
Yes.
Yeah. I
I
mean,
love
I
that.
can give you a weekend lecture just on that. And as you can see, I get very excited about what I know. And there's some like I'm sitting at the airport, I'm looking at people, I'm like, oh my God, poor thing. Like one shoulder's here, one hip is here, the neck is out here, like muscle spasm all over. Poor thing. I wish he would come to me so I could help him.
I know. I know what you mean. Gosh, I couldn't agree more. I could not agree more. I'm wondering if I know you see people of all ages and all different, walks of life, but what are some of the most common dental issues that arise during pregnancy that you see?
Clenching and grinding because the body's under stress.
Yeah.
Compensate for that. There are books right now that have compared pregnancy to cancer.
Really?
But pretty much what your body goes through during pregnancy is very similar what goes on through cancer. That blew my mind away.
That is interesting. I guess as far as the toll it takes on your body.
And all the chemical everything that's basically going on. I mean, you're growing this thing within you, just
Yeah.
like you grow a cancer within you.
Right.
So of course, and there's that old saying, have a baby lose a tooth. So we want to make sure that, pre-pregnancy, you don't have any mercury fillings, you don't have any active infections, your clenching, grinding is controlled, and you're able to digest what you eat, the right food. You have more lymphatic connection in your gut, in your small intestine than any other part of your body.
Yep.
Some of my biggest challenges are female patients that are either pregnant or either want to get pregnant that are vegan, that are
Yes.
vegetarian. Again, to each his own, but these people either are not getting enough omegas and protein from from their nuts and supplements and stuff like that they're taking. And of course,
Right.
with supplements, I mean that's a whole nother podcast. They take the same thing over and over and over and over, and the body's just not excited anymore.
Well, and you're not getting all those extra essential amino acids either.
That you need. Yeah. So,
Mhm.
I mean, that's a whole nutritional aspect, but this is what I see with a lot of patients that the gut is not working properly. So, if they're not able to give those minerals, electrolytes to their baby, well, what happens? The baby sucks it from their bone and from their teeth. That's why a
Yes.
lot of patients get gum disease because the hormonal issues that happen, or they get tooth decay.
Yeah. Gosh. I
So we
love
see that over and over again.
Yeah, there's a few things that you said that I wanna touch on. I love how you pointed out, like, first of all, your protocol when you work on people, it goes through about a year. And to me, I know some people will hear that and say, "Oh my goodness, a year." But you have to remember, like, how long did it take you to get to the bad health that you're at? Not a year, like, a lot longer than that. Take
As an
time.
American public, and I'm the same way, if like one vitamin C is good for me, I want to take 20. Wrong. If anything, you should cut that vitamin C in half and take it in two different doses, you know? So we want things fast. We want overnight. As I said, I have female patients that come to me. I want to get my mercury out. I want to detox. I want to get my root canals out. And I want to be pregnant in 6 months. I'm sorry, you're not at the right office. It
Exactly.
at least 2 years from the time I take the toxins out, and you're working with nutritionists and to get this job done.
Yeah.
And we know that whatever's going on in your oral cavity, mercury, infections during pregnancy, you're passing those on directly to your baby. This has been proven.
Yeah.
Your baby's born guaranteed is going to have some sort of a gum issue, a gum disease issue in the future.
Mhm. Yeah. I know in my training, I was always taught, like, if somebody's wanting to get pregnant, give them at least, like, a year and a half, to start
Basic.
a good protocol. And that's at least. I mean, and then you have to take into consideration, do they have any legitimate fertility issues? But I know now there's fertility clinics popping up everywhere, and you wonder why, you know, this
You
wasn't an issue
might
years ago.
remember during, the movie Rain Man, I think it was, 1 out of every 6 or 800 kids that were born had some sort of a neurological challenge. Now is 1 within 6.
That's insane.
And of course, it's not just it's physical, energy, mental, intuitive, spiritual. So let's say, for example, if you're living next to a Wi-Fi tower. Yesterday, I was coming I mean, I live in, Sammamish, Washington. I was driving down from a restaurant, and I'm seeing more and more Wi-Fi towers that look like trees,
Yes.
try to hide them, you know? And let's say if you live next to a Wi-Fi tower, you know,
All of that
how is that
EMF.
impacting you and your family? You know you work all day, you come home, by the time you go to the grocery store, if you can buy or if you can afford to buy organic, come home, cook it. Easy. Go to Kentucky Fried Chicken, family bucket, mashed potatoes, beans, blah, blah, blah.
I know.
So this is a big subject that would, and bad relationships.
Just the stress, and I think too, like, a lot of these fancy beds, like sleep number beds, all of that EMF and that people are sleeping on, there's
Yes,
a million things
yes.
that
Don't get
impact
me
it.
started on electrical cars, but
Yeah,
it's like sitting in a freaking microwave,
it is.
you
Yes.
know? So
Yes.
my friends who own, I don't want to mention names. Every time I see him, like, "How your jewels doing?"
Yeah,
Like, "You sitting in this, are you okay still?" Like, you know you know, so
I know. That's wild. I do wanna ask you, we were talking about pregnancy and just women, I guess, with their oral health. How important are calcium and vitamin D for dental health, specifically
vitamin D and K2.
with the K2? Because
Most important, if you're not
yes.
You could be taking 1,000 supplements. If you don't have the right vitamin D and K2 in your system, you're not even digesting those supplements.
Yeah,
And of course, when you get to supplements, I mean, I spoke for Whole Foods a few times, and then they came in with that 365, you know, and my opinion, more than 80% of all the supplements out there, especially with these health stores, are contaminated.
you gotta look for the best quality for sure.
Yes, the 365 we were talking about, I asked them, "What's your highest saying supplement?" They said prenatal supplements. Okay. I took one, opened up the capsule, emptied it, sent it to a laboratory. In those capsules, what we found?
I don't know if I
F
know.
aluminum, mercury.
Mm,
And when I reached out to Whole Foods, you know what they said? Oh, it's so minimal. Like, what do you mean minimal? The patient's taking 3 dose capsules every day for the good, like 8, 9, 12 months. There's definitely going to cause some toxicity in the body. So, even with supplements, we have to be very careful to make sure it's a good company, it's reputable, their
mhm.
product is good, and looked at every aspect of
Yeah,
what goes into creating the supplements.
for sure. And I know I tell all my clients and even myself, like I do vitamin D with the vitamin K in it. And I know I see so many other providers that don't do that and just give plain vitamin D. And I just, I don't know. There's certain things we see that just irks me. It irks me. I just can't. But
Well, again, it goes back to that continuing education. As a technology, as a research that's ongoing in so many of these fields, we need to keep up with it.
yeah, I agree.
We need to keep up with it because things are changing.
Yeah.
I travel quite a bit. I'm introduced to a lot of different toxins, hotel rooms, hotels, air flights, what have you. I try to make sure at least once a week I get an intravenous IV support of just the basics,
Yeah.
just to keep my system going, keep my system strong. Consumers, we need to be careful of what we purchase. Like, again, I'm sorry, GNC, but I will never come and buy a supplement from you. That's just a fact. You know,
Yeah.
Whole Foods, I would never even walk into a store like that. Unless I want to find some foofy shampoo, for $100, something like that.
Yeah. Oh my goodness. Let me ask you too. So, what are some dietary choices that can really influence the risk of any kind of periodontal disease or cavities?
For example, sugar cravings. Well, it's not you that craves the sugar, it's the buggers in you that crave the sugar.
The buggers.
The buggers in you, yeah.
Yeah.
So my advice to my patient is, and I believe in it, maybe some people don't, eat for your blood type. Example, I'm blood type, or I'm lucky. I can eat any kind of a protein that flies, swims, crawls. I'm good with it. With nuts, for example, I'm of Persian descent and pistachio is part of my culture. I can't have pistachio. So basically, if you eat something that is not compatible with you and that changes every season, what happens? Your body goes into an inflammatory response. My mom is blood type AB. For as longest time, we couldn't find the right protein for her until we found this book. Basically, my mom can only have lamb, duck, rabbit, and those little Cornish chickens. That's it. If she has a New York steak, my mom goes in comatose because her body is like an inflammatory process that happens. And
Yeah.
again, when your immune system is strong, it deals with these things on some level. But as we get older, we need to be more cautious of what we eat. Of course, there's a lot of genetic testings that could be done, and et cetera, et cetera. And especially when you're toxic, I know people, they can't even have water. They're dealing with advanced immune issues, mast cell activations. I had one patient, poor thing, that's walking around with a little suitcase that is connected to her that gives us intravenous IV of supplements and minerals and vitamins throughout the day. She can't even drink water. My heart goes out to these people. I mean, to be able to eat, to have family, to enjoy. She doesn't have that. You-
That's crazy.
Your gut is your first line of defense. If you're not absorbing, your body's compensating. And of course, if you're dealing with mercury issues and leaky gut, when you're dealing with overwhelming amount of bacteria in your mouth, bad bacteria, and then how could you chelate? How could you detox without proper absorption?
Right.
You know, so that's why I asked, what is your diet? What is your blood type? Do you poop every day? And with men, usually they say, yeah, one, twice a day. Most men, I would say about 90%. But with our female, I would say about 35% of my patients poop every 3, 4 days or once a week.
And some of them think that's normal too.
Yeah, because they've been used to that all their life. Now, as a dentist, let's say if I'm going to go fix your cavity and I have to give you numbing solution, which has preservatives, of course. That's the world we live in. There's no other way for me to get dental anesthetic that works properly. I know those preservatives that is going to go through your liver and it's going to put more burden on their liver. So what am I supposed to say? Are you working with a naturopath? When was the last time you saw your doctor? Are you on any kind of a liver tonic to at least help you through this?
Yeah.
You know, I used to sell certain supplements and tonics and stuff in my practice, but of course, the dental board got mad at me. You just want to charge patients more money. Just go and fix their cavities, and you shouldn't care about what happens to the liver. But I do care what's going on with the liver.
I love how you point that out though. Before any extensive dental work, you do have to think about, okay, like you're going to need numbing, you're going to need some of this medication, but how's your body going to handle it? You got to make sure that you're detoxing it properly, not hanging on to it and causing other problems.
All right.
That's something that I know people just don't think about.
And don't even get me started on antibiotics.
Oh, no. Yeah.
They're these a lot of dentists, a lot of medical, they're giving it away like M&Ms.
Exactly.
You know,
Yeah.
I mean, you know what that does to your gut?
I don't think people do. I really don't. People come in asking for antibiotics. Like it's
Oh,
a
yeah.
drive-through. It's
Yeah.
a drive-through. They don't even know what the purpose is necessarily, but they just ask for it. And most of the time it's not indicated.
Correct.
And it's just insane. I could go on and on for that as well.
My one of my biggest challenges with number of patients is my Lyme patients.
Yes.
They've been on antibiotic like for the past 3 years from these doctors.
Yeah.
Gut is shut down,
Yeah.
and bodies and the tooth decay, gum disease is just, oh, they spend all this money on all this antibiotic. Their gut is destroyed. Liver is destroyed. Kidney. I mean, I can go on, and they have all these dental challenges now, and that I have to face with. And of course, with these patients, I can't do it alone. I need
Right.
someone, you, a proper naturopath that's able to help this patient, which means now thousands and thousands of dollars above and beyond my fees for them to see their naturopath or functional medical doctor to even get them ready for dental treatment.
Yeah.
I have a 2 week protocol that I've created for my healthy patients before they go through any dental surgery. For 2 weeks, we're going to boost up on vitamin D, on K2. These are the supplements I recommend. For the 2 weeks prior to any surgery, this is my protocol. Some patients need intravenous IV support, what have you. But how am I going to treat this release of this infection during surgery? Some of these infections are very capsulated. So when I go there, start removing it, it's like a nuclear bomb. How do I protect my patient? Well, one or two different types of antibiotics, or maybe three. Why? Because these are super bugs. Within 3 days of taking that antibiotics, they're going to start changing shape. So that's one choice. Or again, more advanced intravenous IV support and ozone treatment. The 7 pass, the 14 pass, where the equipment takes your blood, adds ozone to it, puts it back in your system. That's been very powerful. And then, of course, every time you are dealing with an infection for a long period of time, as soon as it's removed, well, your body says, great, I don't have to think about this anymore. What am I going to do next? And of course, your immune system's kicking in to heal the area. that's when the patient starts dumping some sort of a toxin. And it's mainly mercury. So again, my relationship with these naturopaths is they need to understand those three stages and make sure they're at the last stage, they're in the right binders,
Yeah.
not teenagers binders. For example, mercury has its own ripple effect. Whenever the body starts releasing mercury, your body's like, oh, mercury, let me dump some candida to protect my host. I usually know within the first few minutes talking to a naturopath if this person gets it, doesn't get it.
Yeah. I bet. Yeah, for sure. I do have one more question for somebody who say that they are ex-military and has a ton of dental issues as far as multiple teeth extracted, root canals done, and they come to you. Is that somebody who would be on like this year-long protocol?
First and foremost, we know that when I practiced in Seattle, Washington, Bellevue, Washington, I would see a lot of high ranking military officials, them and their family. The number one challenge with these were every time they went from one base to another, they will completely revaccinate the whole family.
Mm.
And we know that these, I mean, we can talk about this for a whole weekend, but we know that basically mercury is the preservative they've used to, you know, so they are dealing with serious heavy metal issues.
Yeah.
Serious heavy metal issues. So my first protocol is, are you working with a proper naturopath or a functional medical doctor? If not, we're going to start. I'll put all the fires out. You need to go back to that to naturopath referral by me, or you find someone to help you start getting these toxins out. You cannot really detox and chelate if you're dealing with infections.
Right. Making sure all
So
those drainage pathways are open first. And
all of that, correct. And your
yeah.
body is able to absorb what have you, you know?
Yeah.
So that is my first line of defense to my military patients because they come to me sometimes, honestly, when I talk to them, I feel like I'm talking to a zombie. They're so disconnected. And working with Dr. Pop, Dr. Klinghardt, and all these other medical gurus, you know, our nervous system is protected by a protein sheet called tubulin, which has myelin in it.
Yeah.
It's been proven that myelin is your antenna to divine. This has been proven to your higher consciousness. And mercury, of course, destroys the tubulin right away. All these buggers, they love tubulin because of the protein content of it. So, in my opinion, mercury, fluoride, all this crap in our water is truly disconnect us and the divine. That's my personal opinion.
I agree.
And I have seen, because after dental school, I almost joined the Marines. I would be a captain to begin with. I would go through a 3 months fast training. And if I want to go back to school, become an oral surgeon or what have you. So before I made a decision, and I was really interested because my mom is from a military family and I have the highest respect for our military. I spent the day, I just wanted to go on the base and look. And what I saw was horrific. These poor kids, because remember, some of these kids have never had medical or dental care. Some of them haven't had even eat 3 times a day. The first time they've had 3 meals is when they joined the military. The number of mercury fillings they put in their mouth. Take the wisdom teeth out all in one appointment. What I saw, I was horrified. If this is expected of me, no, thank you.
Yeah. Gosh. It's a hard world out there. We are just trying to survive here, it sounds.
Absolutely. But thank God for the internet. As I said at the beginning, we really have to do our diligence here. And what happened with COVID really raised a lot of awareness
Yeah.
for a lot of us.
Mhm.
Don't trust what you're told.
I agree. You have got to be your own advocate and look into it yourself, do your own research for sure. Yeah.
Absolutely.
This has been so much fun. I really enjoyed this episode. Thank you so much.
Thank you so much. God bless you and all your listeners.
Thank you for being a part of my journey on What the Gut podcast. For a deeper dive into today's topics, head over to allisonandwellness.com/whatthegut or find the detailed show notes linked below. Hey, and don't miss out on future episodes. Hit that subscribe button, and if you love this one, please leave me a review. Let's keep the conversation going over on Instagram. Connect with me and stay updated and engaged with my awesome community. Plus, share these valuable insights with your tribe. They deserve to feel as amazing as you do. You can find me at Allison_and_wellness on Instagram. Your support means the world to me. I'm looking forward to our next awesome chat. But until then, stay curious, don't drink too much coffee, keep the vibrant energy flowing, and take care of your gut. Catch you real soon. Oh, and hey, if you're ready to dive deeper into personalized wellness, check out my one-on-one health coaching program at allisonandwellness.com. Let's make your journey to holistic health truly transformative.